Let's explore the fascinating world of cannabis, focusing on its history, uses, and the controversies that surround it. We'll dive into the plant's rich historical roots, examine its various medical applications, discuss the potential risks, and look at the social debates that continue to shape its place in society. As you can see, the image here reflects the natural beauty and significance of cannabis as a cultivated plant throughout history. I'm excited to take you through this comprehensive introduction to a topic that continues to evolve and generate important conversations. Here, we see the ancient and traditional uses of cannabis that span thousands of years. Starting with medicinal origins, references date all the way back to 2727 BC in China, where cannabis was used to treat conditions like malaria and even as a form of surgical anesthesia when combined with wine. This highlights how cannabis has long been valued for its healing properties. On the practical side, since the 1600s, hemp fiber from cannabis was harvested for making rope and textiles. In fact, by 1611 in Jamestown, Virginia, hemp was already being cultivated for these uses, demonstrating its importance in early American industry. Together, these points show cannabis's rich history as both a medicine and a critical material resource. Here, we're looking at some key terms and distinctions in cannabis botany that are essential for understanding the plant and its uses. First, hemp refers to cannabis plants grown mainly for their fiber. These plants contain very little to no psychoactive compounds, so they're not used for getting high. Then we have marijuana, hashish, and hash oil. These are preparations made from cannabis specifically cultivated for their psychoactive effects, usually focusing on the flowering tops and resin. Finally, let's talk about THC versus CBD. THC is the compound responsible for the euphoric, psychoactive effects people often associate with cannabis use. On the other hand, CBD does not cause intoxication and can actually moderate some of THC's effects. The image here gives a close-up view of cannabis buds, showing their distinct texture and features like trichomes and pistils, which are important in these preparations. Understanding these differences helps us navigate the conversation about cannabis use and its various effects more clearly. Here we focus on three key medical applications of cannabis, supported by current evidence. First, in patients undergoing chemotherapy, cannabis has been shown to significantly reduce nausea and vomiting, which are common and distressing side effects. This has led to the development of approved medications like Marinol to help manage these symptoms. Next, for individuals with multiple sclerosis, research highlights that THC can alleviate muscle stiffness, improving mobility and comfort. In fact, pharmaceutical products like Sativex are already utilized in some countries for this purpose, offering a practical treatment option. Lastly, cannabis shows promise in relieving chronic pain and certain neurological disorders such as ALS and neuropathic pain. While the data is encouraging, further clinical trials are needed to fully establish safety and efficacy for these conditions. The image here with the 4-drip and medical setting underscores the clinical context, linking these therapeutic claims to real medical practice and pharmaceutical usage. It's important to note that while anecdotal evidence is valuable, rigorous, randomized controlled trials remain essential to guide safe and effective use moving forward. Let's start with how THC and CBD interact with our body's cannabinoid receptors. These compounds bind to CB1 and CB2 receptors found in the brain and immune cells. This interaction is what influences both the psychoactive effects we associate with cannabis and the immune response. Moving on to the body's own cannabinoids, called endocannabinoids, specifically anandamide and 2-AG. Anandamide plays a key role in regulating mood, memory, sleep, pain, and immune function. Meanwhile, 2-AG primarily binds to CB2 receptors, impacting immune activity and memory formation. Finally, looking at the pharmacokinetics of THC, when smoked, it enters the bloodstream rapidly, reaching peak levels in about 10 minutes. THC quickly distributes to organs with rich blood flow and is metabolized in the liver into 11-hydroxy-THC, which also has psychoactive properties. Additionally, THC is stored in fat tissue and released slowly over time. This storage explains why THC metabolites can be detected in urine for hours up to 30 days in heavy users. Together, These points give us a clearer understanding of how cannabis interacts with our body on both a chemical and physiological level. Here, we explore the three main methods of cannabis use: smoking, edibles, and vaping. Starting with smoking, this method produces effects quickly, usually within minutes, and allows users to effectively control their dosage by titrating as they go. Next, edibles take longer to kick in, anywhere from 30 to 120 minutes, but their effects last much longer. However, the packaging of edibles can sometimes cause confusion, leading to accidental overdoses. It's also important to note that oral doses need to be about 3 times higher than smoked cannabis to achieve similar results. Lastly, vaping is becoming increasingly popular. While it offers a different experience, the potency can vary widely across products, so users need to be cautious. The image here gives a visual context with cannabis remnants and related materials, illustrating these consumption methods. When people use cannabis, they often experience a range of subjective effects. Most users report feeling mild euphoria and relaxation, along with enhanced tactile sensations, which can make touch and sound more enjoyable. However, when the THC levels are higher, especially with potent strains or when taken orally, some individuals, particularly those who are inexperienced, may experience anxiety or even depersonalization. Another important point is that high-potency cannabis can lead to sensory alterations, including experiences similar to synesthesia, where senses blend or distort in unusual ways. This can be quite disorienting for some users. Lastly, cannabis use significantly impairs motor skills, reaction times, and attention. This isn't just a minor issue. It increases the risk of accidents like car crashes, making it crucial to understand these effects in real-world contexts. Overall, the effects vary widely depending on the dose, method of use, and the individual's expectations, with some enjoying positive mood changes while others might feel discomfort at higher doses. Here we see the relative risk increases associated with cannabis misuse across several health categories. Most strikingly, the risk of motor vehicle accidents rises dramatically, up to 7 times higher in some cases, mainly due to impaired motor skills and perception. Pulmonary issues such as respiratory problems also show significant increases, especially with chronic use, which can potentially elevate the chance of lung cancer. Cardiac events, including irregular heart rhythms and heart attacks, notably in older adults, also become more likely with cannabis misuse. Cognitive deficits, like memory and attention problems, are another concern. These impairments can persist long after cannabis use has stopped and tend to be more pronounced when use starts early or is heavy. Finally, there's a concerning link between cannabis use and a doubling of testicular cancer risk. Overall, these risks are dose-dependent and tend to be higher among adolescents and heavy users, highlighting why awareness and education are critical in addressing the health impacts of cannabis misuse. Here we have an overview of cannabis use disorder, framed within the DSM-5 diagnostic categories. There are 5 recognized subforms: intoxication, use disorder, withdrawal, induced mental disorders, and unspecified cannabis-related disorders. This classification helps clinicians identify and address the various ways cannabis can impact mental health. Moving to prevalence, it's important to note that between 8 and 20% of long-term cannabis users develop a dependence. In fact, over 5% of the U.S. population was diagnosed with cannabis use disorder in 2020, underscoring how widespread and significant this issue is. When it comes to withdrawal, users often experience symptoms like irritability, insomnia, nausea, and cravings. These symptoms typically begin within 1 to 7 days after stopping use, peak between 2 and 6 days, and generally resolve within 2 weeks. Understanding this timeline can help set realistic expectations for those in recovery. Finally, the image here highlights the importance of behavioral support and counseling. Such engagement is crucial in managing withdrawal symptoms and reducing the risk of relapse, emphasizing that treatment isn't just about the physical symptoms, but also about emotional and psychological care. Here, we have a detailed overview of cannabis use disorder as outlined in the DSM-5. It highlights 5 distinct cannabis-related diagnoses, including intoxication, use disorder, withdrawal, induced mental disorders, and unspecified conditions. This framework is crucial for clinicians to accurately identify and address the various aspects of cannabis-related problems. Looking at prevalence and risk, it's important to note that between 8 and 20% of long-term cannabis users may develop dependence. In fact, over 5% of people in the United States had a cannabis use disorder in the past year as of 2020. This data underscores the significant public health impact of cannabis dependence. Withdrawal symptoms are common and can be quite challenging. These symptoms include irritability, anxiety, insomnia, depressed mood, sweating, nausea, decreased appetite, and strong cravings. They usually begin shortly after cessation and typically last 1 to 2 weeks. Understanding the typical withdrawal timeline, with its onset, peak, and resolution phases, helps us provide better support and anticipate patient needs. While there are currently no medications approved specifically for cannabis withdrawal, behavioral therapies and careful symptom monitoring are the standard approaches. The image here illustrates the importance of compassionate, clinical care during withdrawal, highlighting the need for supportive treatment environments. Overall, this slide emphasizes the clinical features, risks, and management strategies essential in addressing cannabis use disorder effectively. On this slide, we're looking at common patterns of substance use alongside cannabis. As you can see from the pie chart, alcohol stands out as the most frequently co-used substance, accounting for half of the cases. Tobacco follows at 20%, then cocaine and amphetamines at 15%, prescription opioids at 10%, and other substances making up the remaining 5%. This co-use is clinically significant because combining cannabis with certain medications or drugs can lead to serious risks. For example, cannabis can interact with lithium or warfarin, potentially altering blood levels and increasing adverse effects. Additionally, using cannabis alongside alcohol is particularly concerning, as it can suppress the vomiting reflex, raising the chance of overdose. There are also risks when cannabis is used with medications for opioid use disorder, like buprenorphine, where monitoring plasma levels becomes important to avoid complications. What's crucial to note is that research into these interactions is still quite limited, which means clinicians need to stay cautious and proactively discuss these potential dangers with their patients to promote safe and informed use. Here we see the clear upward trend in cannabis use across the United States over the past 3 decades. Starting at just 4% of the population in 1990, usage steadily rises to 18% by 2023. This increase aligns closely with the gradual legal changes, moving from mostly prohibition to widespread medical and recreational legalization in many states. Young adults between 18 and 25 remain the largest group of users, with more adolescents beginning to experiment as well. Another important factor is the potency of cannabis, which has increased over time, meaning users are consuming products with higher THC levels, often with less CBD to balance the effects. Public attitudes have also shifted significantly. While more people now view cannabis use as acceptable or less harmful, there is still concern about the risks, especially among youth who may underestimate potential negative impacts. These evolving legal frameworks and social trends highlight why it's vital to continue tracking how cannabis use affects health and society moving forward. Here we have a summary of the main points we've discussed about cannabis and highlight where further research is needed. First, cannabis has clear medical potential, with solid evidence showing benefits for symptoms like nausea, spasticity in multiple sclerosis, and chronic pain relief. On the other hand, we also see notable health risks, including impacts on cognition, pulmonary and cardiac health, and an increased risk of psychosis. When it comes to how cannabis is used, trends reveal rising potency, more diverse methods of consumption, and greater normalization among young people. Finally, dependence is a significant issue, with many users experiencing cannabis use disorder and withdrawal symptoms. These points emphasize the urgent need for comprehensive research into long-term effects of potent cannabis strains, interactions with other medications, impacts on adolescent brain development, and effective treatments for cannabis dependence. This understanding will help shape both scientific inquiry and public policy going forward. Let's start by considering the role clinicians play in advising patients about cannabis. It's essential for healthcare providers to understand the potency of cannabis products and how they might interact with other medications to offer safe, personalized guidance. This clinical counseling is a critical frontline in patient care. Next, we face the challenge of developing regulatory policies that carefully balance the need to provide access to medical cannabis for patients who benefit from it, while also protecting youth from potential harm. Striking this balance is complex but vital for public health. Finally, we need to prioritize research funding toward answering key questions about cannabis use and its effects. Understanding these areas better will help inform both clinical practices and policy decisions, ultimately leading to improved health outcomes. I invite you all to share your questions and thoughts on these issues so we can have a meaningful discussion. The contact information is also provided if you'd like to continue the conversation after this session.